Hello again, everybody, and welcome to the webinar this afternoon. So this is one of the, as we said just earlier, a patient inclusion initiative of the European Society of Transplantation. And this afternoon, we're focusing on physical activity. So not sport, but physical activity in general after solid organ transplantation. We've got some excellent speakers. We've got plenty of people joining us, and judging by the session we had earlier this afternoon on a different but related topic, I hope we can get quite a lot of chat going on the side as well. So feel fully free to put your comments and your hellos in, or anything about the weather in the chat on the right hand, usually on the right hand side of your screen. Okay then, so I'd like to just reintroduce myself again. So I'm Fiona Loud. I'm the Policy Director for Kidney Care UK, a kidney patient support charity. And I'll be moderating the webinar with Colin. And Colin is also from Ireland. We have several people from Ireland joining us this afternoon. He's a National Projects Manager with the Irish Kidney Association, but I think there's probably a lot more you can say about yourself, Colin. So I'll just give you the word for a moment to say anything else you'd like to about yourself.
I've been working for the Irish Kidney Association for 16 years. My wife has been on dialysis for the last 20 years. And I guess in many ways, this whole area of promoting physical activity is a passion as well as my paid employment with the Kidney Association. So I'm in a very fortunate position that I get to promote this message each and every day as part of my job. So it's fantastic that ESOT have shone the light on this area, and that they've made the definition that it's physical activity as opposed to sport, because I think once you mention sport, a lot of people can turn off. But when people realize the benefits of being physically active on a regular basis at a level that suits them, I think we'll get an awful lot more buy-in, because people often say that if you could package the benefits of physical activity into a tablet, we'd all be taking it.
That's right, absolutely, and I do agree with you. I've never been one to do sport, but I'm transplant recipient as well, I should say. But I do love being physically active, because it really it helped me when I was previously on dialysis many years ago, and it really helps me now as well. I have much more to learn, and I'm looking forward to hearing from this afternoon. So as I said, I'm a Policy Director for Kidney Care UK. I'm also I work with my local organ donation committee at my local hospital here in Hertfordshire in the UK. And I've done a lot of work on national guidelines, and I work with a whole range of different groups, nationally and internationally, to promote the cause of patients, because we are people with kidney disease, and that of course includes promoting the benefits of and access to transplantation and many other things. So, and I had my transplant, I should say, 15 years ago from my husband, who is actually working in the room next to me this afternoon. So you may see him wander by. Okay, so if we could just move on to the next slide, just to give a small amount of background to this. So 2 years ago, some of us met in Copenhagen at the invitation of the European Society for Transplantation, and we talked about what more could be done for people with transplants or waiting for transplants or just had transplants to work together with health professionals on a partnership basis. And that work has kind of sometimes slowly because of COVID and sometimes quite quickly come together over the past couple of years. So we'll be encouraging you this afternoon to take a look at esot.org. You'll be able to see a lot more about that patient inclusion initiative. Go on to the next slide, please. So it's a collaborative entity. I know there's a couple of people on here who were on an advisory group that we had earlier this afternoon, but as I said, it's bringing together people. It's a voluntary group. We're all, those of us who are together this afternoon, will all be volunteers who have some passion and some interest in this, and dare I say, either personal or, as Colin, family experience on that. And we have the passion that's built from that. So if you could go on to the next slide, please. So we have some people who are, the invitation is open. there are a number of organisations across Europe who have joined already. Everybody and anybody is welcome to join, and you can just go off to esot.org and you can get in touch and just say, hey, this is something I'm interested in. And that could be, small charities, large charities, various initiatives, those are all very welcome to join. So you'll be seeing this slide twice this afternoon. I think it's worth mentioning twice. So if you go onto the ESOT Congress website, you can have a look at the kind of things, because ESOT, it's very much it's been a professional organisation, but it's changing, as many of our national organisations are here in the UK as well, to do a lot more in partnership, which I think is just so important for improvement, for understanding, and for gaining as much as we can access to or from our various transplants. And there are a few sessions here highlighted from the Congress, which where people will be talking about some of the more perhaps patient related things. And there are some of them there, but you can have a look at the rest on the website. By no means is this an exclusive list. And what I think it's time for me to do now is to probably hand the floor over to Colin in Milan, who's going to give you a little bit more information about what's going to happen this afternoon. So over to you, Colin.
Thank you, Fiona. You can see on the screen there that we have a variety of speakers coming both from the professional background and from the patient background to kind of share their story, their findings, their insights into the value of sport, physical activity. I should slap myself on the wrist for that one. But I think it is very interesting that we have all perspectives kind of been covered here, that when it comes to motivating people with transplants to engage in sport, it needs to be a collaborative approach. And I think this topic kind of encapsulates very positively the growing relationship between ESOT and ECPO, that working together we can enhance the outcomes for patients, because patient organizations can add on some things on top of what can be done by the hospitals, and the hospitals can do a lot of very good research to kind of make the logical case for why physical activity is a very good thing. Now, throughout the session, the chat function is open, the Q&A function is open, so please do feel free to engage. That if you find you have a pressing question or you're seeking a point of clarification, please do make sure when you write it in, if you want to direct it at a specific speaker, that you're looking for their response, that if you use their name. So to kick things off, to give us a sense of who we have in the room, as it were, the virtual room, we're just going to launch a very simple poll. You should see it there on your screen now. And we'd just like to know who you are and what's your motivation, I guess. Love this. It's like watching the elections or something.
Yeah, I've just realized I can't fill it out as well. I go straight to fill it out. Of course I can't.
As a co-host.
Yeah.
So it's good to see we have representation across all the areas, and very pleasing to see that there's a significant number of people with a transplant who have logged in. So I think hats off to the people in ESOT who promoted this and helped get the message out that people with a transplant knew this event was happening and that they could properly engage. So without further ado, we're going to kick off with our first speaker, who is Stefan Desmet. I first met Stefan a number of years ago at a Transplant 2 conference in Leuven. Beautiful city, beautiful people. And I think you're going to hear it throughout this evening's session. We're all going to heap praise upon Transplant 2 and their cycle from Leuven to Milan. Absolutely an inspirational endeavour. And not the first time they've done it. When we were in Copenhagen, they cycled there as well. So great bunch of people really delivering a very powerful message. So well done to them. Now, what's Stefan's background? He's a physiotherapist with an interest in exercise physiology. And he kind of likes to bring the academic and field work or kind of the lived experience, as it were, together. And so it's kind of bringing the science behind the actual fact and what people are experiencing out there. So he's acted as a scientific coordinator at Transplant 2 and as a physiotherapist working with patients with internal disorders in Leuven. And he's recently received funding to initiate a multi-centric study on physical training after abdominal organ transplantation. I do love the title of such research papers. It's you kind of have to practice a little bit to read them out. It's quite a mouthful, and I do look forward to actually reading the outcome of it. So, Stefan, it's over to you.
Thank you, Colin, for the introduction, and hi to everyone at home and in Milan. It's so lovely to see so many people joining in on this session. It shows that the awareness of the importance of physical activity and exercise after transplantation is gaining and is growing. So good to see that. I have nothing to declare for this presentation. Feel free to share any slides on social media. So today I will be talking about the evidence behind physical exercise and physical activity after solid organ transplantation. But if we talk about these terms, I think it may be required to provide a brief introduction to the common terminology to set the stage during this presentation and the following ones. So physical activity. Physical activity is any bodily movement produced by skeletal muscles that results in energy expenditure. So that may include movements performed during leisure time, at work, day-to-day activities, etc. It has different dimensions, such as intensity, frequency, the duration, as well as the type. And looking at intensity, we can divide it in light intensity, moderate intensity, and high intensity. Light physical activity will barely increase heart rate and breathing frequency. And it will increase, or it corresponds to an increase in resting energy metabolism of 1.5 to 3.0. So resting energy production will be increased by 1.5 to 3.0, and it corresponds to a rate of perceived exertion score, which is a subjective score, of 1 to 4 on a scale from 0 to 10. Moderate intensity will noticeably increase your heart rate and noticeably increase your breathing frequency. You will also start sweating. Resting energy expenditure is increased by 3 to 6-fold, and the rate of perceived exertion score corresponds to 5, 6 on 10. High intensity physical activity will substantially increase your heart rate and breathing frequency, and you will substantially start sweating. Your resting energy expenditure will increase by 6-fold, and the rate of perceived exertion is approximately 7 to 8 on a scale from 0 to 10. Physical exercise, on the other hand, is a subset of physical activity that is planned, structured, and repetitive. And it's mostly performed with the intention to improve or maintain physical fitness. And it's also mostly performed at moderate to high intensity. It involves aerobic, strength, flexibility, and balance exercises. So I already mentioned the term physical fitness. What is physical fitness? Well, physical fitness comprehends different components. And depending on the definition that you use, It comprehends cardiorespiratory fitness, musculoskeletal fitness, motor fitness, a morphological component, and a metabolic component. The cardiorespiratory fitness is often called the aerobic capacity, which corresponds to the maximal oxygen uptake, which can be measured by a cardiopulmonary exercise test or estimated by a 6-minute walking test, for instance. Musculoskeletal fitness comprehends terms or traits such as muscle strength, muscle endurance, muscle power, which is the explosive power. Motor fitness comprehends speed, agility, balance, coordination. The morphological component, it involves body composition, fat distribution, bone density, as well as flexibility. And then finally, the metabolic component involves glucose tolerance, insulin sensitivity, lipid metabolism, diabetes, etc. So how active should we be? Well, the WHO, the World Health Organization, recommendations include or say that we should perform aerobic activities at least 2.5 hours a week at moderate intensity. Or we perform 75 minutes per week at high intensity. Or we perform an equivalent combination of both. Next to aerobic activities, we should also perform muscle strengthening activities 2 times per week or more. Finally, these aerobic or muscle strengthening activities should also challenge the postural balance at least 3 times a week. That can include, for instance, walking on an unstable surface in forest. That can include dancing, etc. But for many of us, these recommendations may be out of reach. And then we need to adjust our goals to the current abilities that we have. We need to implement stepwise, gradual progression, and also promote light intensity activities, not only moderate and high intensity activities. But most importantly, and this is a message I would like to stress during this presentation, also small increases in physical activity count, particularly in those who are the most sedentary. And this is represented on this graph, where you see on the x-axis the amount of physical activity, for instance, in minutes per week, and on the y-axis the risk for chronic disease, the risk for mortality. Let's take, for instance, somebody who's inactive. That person has a high risk for chronic diseases and high risk for mortality. But a small increase in physical activity, which does not need to reach the recommended dose, will enable a substantial increase in health benefits. And then we may raise the question, should we focus on exercise training or should we focus on physical activity? Well, for some people, it may be wise to first focus on exercise training to increase physical fitness, to increase confidence, and actually to increase the ability to be active. And once we have gained progression in physical fitness, once we have gained a good physical fitness, we have the ability to perform physical activity within a wider range of intensity, a wider range of volume, and wider range of physical activity types. And this physical activity should be then embedded in daily life. So what are the consequences of physical inactivity? Well, physical inactivity causes a lot of chronic diseases, amongst which cardiovascular and cardiorespiratory diseases, musculoskeletal diseases, diseases of the nervous system, but also depression, diseases of the reproductive and digestive system, amongst other cancer and liver steatosis, diseases of the immune system, infection, the risk for infections, rheumatoid arthritis, but also bone diseases, osteoporosis, the risk for falls, as well as endocrine diseases such as diabetes, obesity. And unfortunately, after transplantation, we need to adhere to an immunosuppressive medication program, but this immunosuppressive medication will additionally increase the chance for the development of these diseases. So in the pandemic of COVID-19, I think this was some interesting data I wanted to show as well. So this is a very novel study by Salis et al. In a population of American citizens, quite a big population, over 48,000 subjects, in which they assessed physical activity prior to COVID-19 diagnosis. And what they saw was that those who were the most active had the least chance to become hospitalized due to infection. And more importantly, those who were somewhat active also had less odds or lower odds, lower chances to be hospitalized compared to those who were completely inactive. This also holds true for the chances to have to be admitted to the ICU. And this also holds true for the chances for mortality. This paper, or this novel study, had three major conclusions. Well, first one, even activity levels that did not meet the physical activity guidelines were significantly associated with reduced odds of hospitalization and death. Second, being consistently inactive was a stronger risk factor for severe COVID-19 outcomes than any of the underlying medical conditions and risk factors, except for age, a history of organ transplantation. And the third and final conclusion was that physical inactivity was the strongest risk factor across all outcomes, compared with the commonly cited modifiable risk factors, which include smoking, obesity, diabetes, hypertension, cardiovascular disease, and cancer. But let's take a look to the data in transplant recipients. And here you see, we know based on some cross-sectional data in kidney transplant recipients, that the less physically active you are, the higher the chance for the development of obesity, diabetes, and cardiovascular disease. Looking at some longitudinal data, also in kidney transplant recipients, we see that those who are most inactive, so less active, have the highest chance for cardiovascular mortality compared to those who are moderately active and compared to those who are highly active. Same holds true for the mortality, for the chances of all-cause mortality. But if we want to take a look at the effects of exercise training, and we want some strong evidence, we need to take a look at data from intervention studies. And Janadis Ferreira and her colleagues recently investigated all the literature about this topic. And they pulled all data together from randomized clinical trials. And they put it in, they did a statistical analysis on it. So based on all types of organ transplantation. And they concluded that a period of exercise training after organ transplantation does indeed increase cardiorespiratory fitness, VO2 max or VO2 peak. It also increases muscle strength, which is to be expected, of course. Interestingly, it also increases quite some elements of health-related quality of life, among which physical role, general health, social functioning, and mental health. What about fatigue, common symptom after transplantation? Well, there is some growing evidence that exercise training will improve symptoms of fatigue and will improve quality of sleep, although we need more high-quality data on this matter. another very recent study showed that in a cohort of kidney transplant recipients, de novo kidney transplant recipients, but because they only received their kidney transplant 2 months ago, who were then engaged in a physical activity or exercise training program during 12 months, were more likely to be employed, a paid job, after 12 months compared to the control group who did not receive an exercise program. So for me, I interpret these data as that exercise training will improve the social connectedness, but more the societal reintegration. And furthermore, it will also be beneficial for the cost efficiency of this intervention. We need more data to confirm other hypotheses, which may be logical to my experience, well, which may be expected, but remain hypotheses regarding the positive effects of exercise training on long-term graft health, cardiovascular events, incidents, cancer incidents, infection incidents, healthcare costs, medication requirements, incidence of falls, and survival. There is just not enough good scientific evidence to confirm that exercise will improve it. We still need to study this. Furthermore, we also still need more data on the optimal mode of implementation of physical activity and exercise training. So there is growing direct evidence that exercise training will provide health benefits in transplant recipients. And there is overwhelming indirect evidence in other populations stating the same. However, it is one thing to know about its benefits, it's another to implement it in daily life. I think the study of implementation, well, it may deserve actually a whole presentation. I won't be focusing on too much during my presentation, but I'm sure that my colleagues later on will touch upon this through different angles. So, as a take-home message, exercise training after transplantation will promote recovery in physical fitness, which includes aerobic capacity, strength, balance, etc. It will promote self-efficacy, it will prevent chronic comorbidities, and it will promote quality of life, including both physical and mental well-being, as well as social connectedness. Active living after transplantation, well, will maintain the health benefits of previous exercise training, should be integrated in daily life, and should be adapted to the personal needs, capacity, and preferences of those engaged in a program. Every small improvement in physical activity counts. And finally, it's never too late to initiate or re-initiate physical activity in your life. So most important message, start today. I thank you for your attention.
Thank you very much, Stefan. Lots of food for thought there. I should remind everybody that we're having a kind of question and answer session at the end of all the presentations. So people do put your comments in the chat so we can save them up for later. But maybe I can just take the privilege of asking you one simple question, sure. Stefan, which is, you talked about it several times about, we know that there are benefits for these things. It's never too late to start. But what would you say to somebody who might be feeling, tired, overweight, a bit sort of underwhelmed about the whole thing? What was the kind of one thing you'd say to people to say, get going? What would be the thing that would make people just want to get going or just do something? What would your advice be?
Yeah. It depends on the patient. We should identify barriers, identify facilitators to be active. What does the patient want to do? What does the patient enjoys doing? And we don't need to focus on these cutoff values of 150 minutes per week of physical activity. We should move away from that, in my opinion. We should focus on small increases. Okay, what can we do? A small step to increase physical activity in your daily life, which can be, for instance, each morning go to the bakery, buy food. instead of just taking something out of the fridge. Just a small suggestion, but those small steps will make the difference, and then we can gradually further improve physical activity levels and physical fitness.
Very nice. Yeah. So that's why we called this conference, isn't it? Every step forward, you know, small step forward is still a step forward, because that's exactly right, isn't it? So,
exactly.
So thank you. That's great. But do keep putting your questions in the chat, and thank you very much, Stefan.
My pleasure.
What we'll do now is, I think I'll introduce our next speaker, if that's okay, if Darren would like to put his camera on. And it would be my pleasure to introduce Darren Cawley, who's a motivational and educational speaker based in Ireland. I've had the pleasure of hearing him speak before at a conference in the UK, which was very inspirational and quite very enjoyable as well. He also qualified at a university quite near where I live, which is always a recommendation, although I didn't go there myself. And Darren's going to talk about From Pain to Purpose, the motivational influence of exercise. So Darren, could I hand the floor to you, please? We can get the technology to work, which I think it is. So fabulous. Darren?
Now, thank you very much, Fiona, for that lovely introduction. Darren Cawley, as I said, is my name. My background is in, believe it or not, sports and fitness. But I suppose the way I look at it, from pain to purpose, those of us with a transplant have went through pain, the pain of diagnosis, the pain of lifestyle changes, and of course going through a transplant, hopefully. But after the transplant, you have the opportunity really to see the light. It's an opportunity to get back on track and to find your purpose again. And for me, physical activity and adopting a healthy lifestyle were a driving force in making that a reality. Now, a bit about me. I went to college, as you said, in England, doing sports and fitness studies because I love sports. And I grew up playing kind of Gaelic football and boxing, rugby, soccer. My father said it was just to get out of the house because I had 4 sisters, so maybe that had something to do with it. But when I went to college, I went to study sports because I had a great love for it and I really enjoyed participating. And while I was there, unfortunately, I used to get a lot of bad headaches and vision problems, and an optician sent me to the hospital. And within the space of 10 days, I went from what I thought was a healthy sports and fitness study student to someone with a chronic, serious illness. And that was an enormous change, an enormous kind of disaster for my life at the time. And I started dialysis almost straight away. And those here, a lot of the transplant people know, like high blood pressure, lack of time, dietary restrictions, you feel sick and tired a lot, and you'd often feel isolated and lonely. One way it was described as being vertically ill, as in you're standing up, you're walking around, you look relatively normal, but inside you feel terrible. And then one day you get a call and a lot of these things start to disappear, which is fantastic because you get a transplant and it feels like you've got a new body. And today we're looking at physical activity as an important lifestyle issue. And for me, this is very much intertwined with kind of the mental, emotional and social influences of living and having a healthy lifestyle. Very much kind of mens sana in corpore sana, that Latin phrase, a healthy mind in a healthy body. And it's, I guess, one of my definite beliefs. And I'm just going to talk briefly about the transplant and the transplant dialysis games, because the games for me were the catalyst for moving away from the pain and toward the sense of purpose. And when I went to my first games in Japan back in 2001, I had no aspirations really. I wanted to set my body a few challenges because it had set me so much from the previous few years being on dialysis. And saying that, I was confident going to the games. I was really looking forward to it, but I was in reality full of apprehension and doubt and fear. And that kind of showed. The first event I did was in cycling. And I didn't do much cycling. I didn't do much training. I assumed that everyone there would be kind of older and sick because I was quite young and I was picturing myself on dialysis, but now I had a transplant. And I went to the cycling event and I gave it everything and I came third. But unfortunately, that was third last because everybody destroyed me. And for me, the main reason was I had this sick mentality. And at the games, for the first time, I saw other people, other patients who are now seeing themselves as athletes. And they were role models for me because I'd moved out of the hospital environment, but my head was still living as a sick person. So it was very important to me to meet other patients who are living this active life and kind of being more proactive, taking a lot of time on their exercise and kind of working out a lot and pushing these transplanted bodies to see where they could get to. So it was highly motivating, and it made a big, big change to me and how I live my life. But of course, as Colin mentioned and other people mentioned, it's not just about competition. It's about creating the healthy habits. For me, being from a sporty background, I veered towards transplant games and that. But a lot of people are not into competition, and that's fantastic. You don't need to be. But when you get a transplant, people often tell you you're lucky and, you know, all your prayers have been answered. But at one stage, I lost a transplant and I went through 9 years on dialysis. And the change to a transplant can be very, very challenging. Or you fear that any strenuous exercise might cause problems to your transplant, so you'll be overly careful. And they're both very real fears. But again, what you need to do, I guess, is to try and get as much good advice as possible. Like Stefan was sharing with us some of the realities and the papers that show that exercise works. It's safe for most transplant recipients, to work with your transplant team and to watch, very much as I did, watch and learn from other people. Something to keep an eye on, of course, is not to compare yourself with other people, but just to watch them and see what they're capable of, and then try these things out yourself. As Mark Twain said, comparison is the death of joy. So you have to be careful how you approach exercise. But the reality is, the irony is that a little energy expended in the right direction ends up giving you more energy in return. And that brings me on to the benefits of having a transplant and the benefits of kind of changing your lifestyle to be more outgoing, more physically active, is that you start to regain control of your life. And changing how you view your health is a big part of that. Certainly a lot of people see themselves as sick people, but when you get a transplant, you can kind of change that mindset to become a healthy person. Now, you still have all the health issues, but to see yourself as a healthy person is important for your mind, I found anyway. It'll help you kind of regain your life and improve your quality of life. And that's the thing people often overlook. The quality of life is what's so important. And there's a big distinction between lifespan and health span. Lifespan merely is how long you live. And you could be alive on a life support machine for 10 years. You have zero quality of life. But it's health span that is important. Not how long you live, but how long you live with good health. And this is often within your control to a large degree. And I always encourage people to take more control, be an active participant in your own health care, and to take responsibility. And luckily, this is kind of what I did. And I moved from a dialysis patient to get a transplant, to go to the games, and they went so well for me. You know, it's a great feeling to represent your country, to hold up an Irish flag, because when you're on dialysis, certainly in my case, you don't think that you'll ever kind of be able to be proactive in life again. And although I was healthy on dialysis, getting the transplant really allowed me to push on a great deal and do so much more. So it's not, I was just going to say about exercise, kind of finishing up soon. It's not just about surviving kidney disease. It's about thriving and regaining control of your life. And exercise kind of certainly does a huge benefit to your body, but it also helps your mind and your attitude and your mood. And these are kind of the physical and mental, emotional aspects that increased physical activity can provide for you. And having a healthy lifestyle is probably the best thing you can do to ensure that you live a happy and healthy life. Because that's really, when we talk about having a sense of purpose, going from pain to purpose, being happy and healthy is the end goal. And that's where having this good, positive, proactive kind of approach towards physical activity ends up giving you more energy, you feel better about yourself, and you can live a much better life. Because that is the goal I certainly set for myself. And I think it's something that all patients should set for themselves. So thanks very much, guys, for listening.
Darren, fantastic as always. Always an inspiration. I remember, I think it was about 8 years ago, a mutual friend of ours, Peter Heffernan, was organising a relay swim across Dublin Bay. It was about 8 kilometres in distance.
Yeah.
Long story short, I jumped on it and said, oh, I'd love to cover the social media on that. It'd be fantastic. It'll give a great message about the power of organ donation and transplantation. I ended up being one of the swimmers in the group. I was the only one who wasn't a transplant recipient, and I was possibly one of the slowest swimmers in the group as well. But I think what I got out of that was I was surrounded by positive energy. I was surrounded by, yes, we can. And that whole concept that you referenced of being a role model, when we're talking here about ESOPs kind of facilitating the medical professionals and the patients coming together to improve healthcare, how do you see the role of a role model kind of fitting into that picture?
Well, it's putting the theory into practice. And when we say putting theory into practice, it's putting it into the patients, who obviously you don't like to be referred to as a patient, but putting into the person who has a transplant. If you have the confidence that you get from your medical team and the research to get out there, be more proactive, and see the evidence that more physical activity will work for you, other people will then kind of copy you and come on board, which is, it's so important. Role models for me was the turning point in going from being a sick person to someone who was healthy. And it was an enormous thing to see other people. So I think that's why this particular symposium is so beneficial, because it has the science and the practical application viewed through a patient.
Absolutely. I have to agree with you totally on that, Darren. Thank you very much. Keep up the good work, and well done.
Pleasure.
Right. Moving on now, our next speaker is Frank Kuipers from the Netherlands. I had quite an informal conversation with Frank a couple of months back about kind of both of us and our take on physical activity or transplant sport or whatever it might be. And when the conversation started, I was very much kind of, yeah, I've got this. I'm going to tell him everything that's brilliant in sport. But I found myself kind of basically being quiet and listening, because Frank kind of brought it down to the real basics of the value of physical activity and it being at an individual level, that stepping forward for yourself, not stepping forward and comparing yourselves with others. And it was a wonderful kind of opportunity for me to kind of reassess and remember why I kind of got into the promotion of physical activity for people on dialysis and people post-transplant. So just a little bit on Frank's background. He is the co-founder and vice president of the Dutch Lifestyle and Transplantation Foundation. He's chair of the Patient Advisory Committee of the UMCG Transplant Centre. And he's also involved in reviewing transplantation-related research proposals, is a board member of, was a board member of the Dutch Sport and Transplantation Foundation, and is a founder member of the Dutch national transplant soccer team. He has received a triple organ transplant in 2016. He's been working as a business consultant. He has a bachelor's degree in navigation IT and a master's degree in management. Frank, you must be about 200 years old to fit all of that into your life. Fair play to you.
And I lost some years too.
So
talk about this.
Over to you, Frank.
Okay. Hi, everyone. The title is First Step is All It Takes. And I need to click on this one, nothing to declare. I'm very glad to see many patients in the room. And for many of you, because you know of the seminar, of the webinar, you are most likely into an active life. Some of you don't, but in the end of my presentation, I would challenge you all to take some steps. That's my goal for today. I'm 60 years old now. We have 2 children. They were very small when my first symptoms of sickness started. And I want to talk a little bit about the kids because they're a much overseen item in transplantation. We try to incorporate our kids in most situations based on their age. So you see, 97, the first symptoms. I got a transplant in 2016. It was a long trajectory for both of us, for both the kids, for me, my wife. And they learned a lot during this period because they went to school. They got the biology lesson, so we could tell some more about the physiology of a transplant. And they learned a lot of more things than only physiology. The health was slowly degrading with a lot of hospitalizations and with 2 possible outcomes. One is death, and the other one was a transplant, and it looked very far away for a long time. And one of my physicians said, you should do something about your condition because better in is better out. There's much to do nowadays about rehabilitation. It's what Stefan Desmet was talking about in his last few seconds of his presentation. Very interesting subject. I thought I would gain a lot if I took up some activity, stay as fit as possible. So I gave football training to kids for a year, some of 10 years, I believe. And the other thing we did was get a walking buddy. Because if you have someone to go on a walk on a daily basis or a weekly basis, you will get in shape or be better in shape for your transplant. So we found ourselves a dog, and he was our buddy my buddy for a very long time. When I was in 2015, I thought I would like to check how my physical state was. And that's called the VO2 max. You know that Stefan was talking about this. Desmet was the cardiorespiratory fitness. And the result was very poor because I was looking like an 80-year-old woman with a very poor condition. And then on my birthday in 2016, my life changed, and I changed from Frank 0 to Frank 2.0. It was quite an event happening. The transplant dured was about 13 hours, and I had a lot of problems right after the transplant for the mental issues. And this is a drawing one of the surgeons had made of the transplant. I had a triple transplant: a liver, pancreas, duodenum. Dieter Montbelier knows what it is. After this, I tried to get fit again, because I had lost a lot of muscle tissues for my liver disease. I tried to go to training. I joined the Sports and Transplant organization, went to bicycling, which I never did before. And I was able to join the Transplant too. You heard Stefan talking about this. Also in 2017, together with the transplant surgeon, Simon Hofkern, I reached the top of the Mont Ventoux, which was an astonishing achievement, I believe. And 10 days after that, I went to the Transplant Games in Malaga, did my utmost, but also realized that we are in this situation, in a transplant game situation, we are with very few people. In Holland, there is not even 1% of the transplantees involved in sports. So there are very, very many people who won't be into this kind of activities. But activities, just physical active, is of has a large beneficial effect for many transplantees. So I thought, well, there must be something to do to get people active on a normal basis, based on what they would like to do, instead of having this role models they can't reach, because the majority of transplantees are not that physical, able to do this kind of sportive things. Then I saw two friends of mine. One of the friends is available, is in the public right now, Remy Schrijver. The other one is Rob Ratelan. They started a Facebook group in 2020. They called it Active After Transplant. And we had some talks in January, and I enjoyed them. I joined them in January, and the major thing of the Facebook group is to get people into physical activities again. And there's no competition at all. We only try to motivate and inspire people. Get off the couch, be active, post your messages, and inspire others to do the same, and to inspire others to get active too. And with others, we also mean the people who are on dialysis or are on the waiting list for a transplant. And the reason for the starting of the Facebook group was that there was a lack of support. Right after transplant, you have a lot of issues on very many aspects of life, and there is hardly any time or program to accompany you, or to say what you have to do, what you can do. But there are many transplantees who have been on the boat before. So the support from your buddies is, especially on Facebook, is always there. You can join them. And I thought there might be that there is a great framework. I will talk about this in a minute, which I believe is beneficial to the use of the Facebook group. What we also did is we connected with an initiative from Chiesi in combination with one of the transplant centers in the Netherlands, AMC. It's called Walk and Talk. And with Walk and Talk, they have kidney transplantees, transplant patients, and people on dialysis having regular walks in the vicinity of the transplant center. We tried to connect with the Walk and Talk, and we did, and we augmented the number of transplant centers in the Netherlands from, you see here, 3 centers. We made it, we delivered people to start walking groups, and now there are 6 in the Netherlands. We also asked our members if they would be interested in having people accompany them during walks or bicycle rides. So the only thing what they had to do is to fill in their city of habit. And this is what they did. So we are with about 500 people at the moment in Belgium and the Netherlands. Half of them has filled in this this figure, and we see that during the time people are starting to walk together. But I will go back. What we do not promote is any kind of competition. And if there is any talk about medication intake or COVID-related stuff, we try to minimize this because it's only about getting an active life, and the other parts are not for this group. And we see that there is many interest for of many patients to fill in their activities. One of our researchers in the UMCG Groningen is Edwin van Eijrichem, and he has written a thesis on an active life, and he investigated what barriers and facilitators there are for getting active after a transplant. And you see on the vertical axis that there are some stronger and weaker signals or to get active, and you see left the most important barriers, or the most dominant barriers, and to the right, the most dominant facilitators. And what we do with this group, what we see it is in this Facebook group, is that we are motivating all members to post their messages, and the motivation makes other members start moving because they see what others do, and though they might not be able to do the same, they will try to get active. So there is a large social role for the Facebook group, of course, and we have the social support too. If there's people have problems, we try to motivate them to continue. If there is a problem with the physique, there are many other members who are able to give it a good place. What we see is that fear of being active is mentioned too. Oh, sorry, is mentioned by members. That they are afraid of getting active with a transplant because you never know what is too much, or if you could ride a horse or go into mountain biking, or if you have done enough or just not enough. And because there is a lot of knowledge in the group already with this many people, the fear is brought down very much for members to get active again. We also have this with the walk and talk groups, the group activities. With the group activity, bad weather isn't an issue anymore because you won't let your buddies down. What we try to do also is to promote that your active life will become a routine, not a thing you do once in a week or once in a month, but have it an active life on a regular basis. We don't talk about the consequences of inactivity because that's a negative side, but we do mention the consequences of an active life. And we see the consequences, and everyone sees the consequences of others. There are a lot of positive effects of this Facebook group for the members. And the last three I want to mention is that your energy level will get up for this active. We see it that the energy level gets up. We see that people are getting stronger, are able to do more meters or more on a bike or get stronger. And the weight is always an issue, but that's for some other part of a transplant session. This is the model I use. It's called the self-determination theory. And the axes are autonomy, competence, and relatedness. It's not for this meeting to see, to go into detail, but this is in our continuous focus of what we try to achieve with the Facebook group. I would like to show you some quotes of some of our members, and I will read them. Everyone started at a very low level. Having made your first step should make you proud of yourself. A good job. And this is after one woman said, well, I see that there are many people doing a 10-mile walk or a 20-kilometer bike ride in a short time. There's no competition. It's only about you and how you can do your activities for yourself. Second one, do not compare yourself to others. It's also a reaction. It's about you. Third one is also very peculiar because it's about prehabilitation. Prior to my kidney transplant, I tried to keep myself fit. And now 2 days after my transplant, I could walk 3 times for 6 minutes. This is a person who receives a kidney from his wife. 2,760 steps. It ain't much, but it was all I could do, which looks like a little bit of an excuse. She has not done that much, but the reactions are positive. It's all about relative. All is relative, but you got off the couch and did it. And the last one is one of the best. And if I see some activities of others, I wonder why I am not able to do the same. But on the other hand, it does motivate me in a very great deal. It makes me determined to do the same, step by step. Support, empathy, and encouragement from others does miracles for me. It motivates me to continue and expand my physical activities even more. She was on dialysis, and we see her progression on a monthly basis. Of course, there are issues. Like all transplantees, we have our problems, and Remy described it as the Mondays, and all of us have this. We all have our moments that we are not able to do any physical activity at all. And it's okay. Everyone acknowledges this. And the other one is also interesting, because if you have done a very high level intensive bike ride, for instance, or swimming distance in a short period, you won't get that much response. Sports-oriented messages are not getting the response the people who create the message would like to have. And now, this is what we did. We started the Facebook group, and I would like to challenge you, all members, all the transplant persons, to get into an active life and take the first steps yourself. And maybe if you are already in an active life, I would like to challenge you to motivate others to take their first step. Because what the patients do, what we as patients do, is hardly accomplished by the professionals. So my question to many of you is to start something of the same support group. And I'm very happy, and Remy also is, to help you out in doing the same. The thing is, for this Facebook group, is that you need the cooperation of transplant centers. And you will get it. If you start a group, you will get this support from them, because they see how important this body operated network is for transplant patients. So this is my final: start walking groups like EAC's Walk and Talk, maybe on a national basis. Talk to the transplant centers. Maybe the professionals of the transplant centers can help you. There are possibilities to do. I hope you take it and start getting active, or promote active life for your fellow transplantees. Thank you.
Thank you, Frank. Thank you very much. And I'm glad to see this is Frank 2.0. I think in the interest of time, we need to press on. So we'll save any questions till the end, if that's okay. And if I could ask Charlene to join us on the screen there, that would be great. It's my pleasure to introduce you, Charlene. So I know Charlene, I've known her for a long time, actually. So Dr. Charlene Greenwood, she's a consultant physio at King's College Hospital in London. She's an honorary senior clinical lecturer there. She does all sorts of different research there also. She co-chairs the UK Kidney Research Consortium, and she's the president of the UK Kidney Association. And I think on that note, Charlene, I'd like to welcome you to take the floor and talk to people about, well, you're going to talk about getting started. We've talked about that quite a lot this afternoon, but getting started and, importantly, maintaining motivation. Thanks, Charlene.
Lovely. Thank you, Fiona. Thanks for the introduction. And hi, everybody. And thank you for this wonderful opportunity to come and speak to you all about how we can get started with physical activity and also maintain motivation going forwards. I don't have any conflicts of interest to declare, and just to let you know that you can share the presentation on social media. That's my Twitter handle there. Okay, so we've already heard a lot about why being physically active or doing exercise is important. Stefan's shared a lot about the evidence. We've heard a couple of very inspiring talks from people who've had transplants. And so we know that it helps us to feel stronger, it helps to improve our heart health, quality of life, blood pressure control, diabetes control, emotional health, but also many other health benefits. So in this presentation, I want to concentrate on how we can engage people with physical activity and exercise, what it is that we can use as helpful resources, and also who and how we can sustain and maintain motivation to carry on being physically active. So firstly, no one wakes up in the morning and thinks, I'm going to exercise. If they did, I would certainly be out of a job. And also we know that even in the general population, so people who don't have a chronic health condition, levels of inactivity are extremely high, and most people find it difficult to be physically active and to exercise. So before we consider what we can do, we need to take that step back and just have a look at what some of the challenges are when you have a kidney transplant or a different organ transplant to being physically active. So Fatigue is one of the things which, especially at the beginning, after having a transplant, people can feel it's quite difficult. Weight control, so especially in that first year after a transplant, when medication side effects of immunosuppression can make you increase your cravings and your hunger. So weight control can be difficult. Multiple appointments, as I've mentioned, medication side effects, and also fear. And I think this is one that both of our transplant recipients who've talked to us this afternoon have picked up on. It's a very real fear. It's a fear of damaging that precious gift. And a lot of people have said that, you know, when my heart rate increases and I get breathless, I worry that I'm actually damaging my transplant. So it's a very real challenge, and it's something that as healthcare professionals we need to be reassuring about. So whilst some transplant recipients, and we've heard from a couple today, have taken up physical activity and exercise, continued with previous training regimes or started new ones, what we also know is that for some people it is very difficult to make that first change from being inactive to becoming more active. And we know that at the heart of people not changing, there is ambivalence. And ambivalence is when you're in two minds about something. So it's where you know you should do something, but you don't. And I use an example here of my energy bill. So I know that if I went online and I looked on one of these platforms, I could get myself a better energy deal. But I'm really busy, I've got other priorities, so I don't do it, but I know I should do it. It's normal to get stuck. It's normal for us to get stuck when we were wanting to make a change. It may be because we're going to lots of different transplant appointments. It might be because we are worried about how we might damage our transplant if we do activity. Healthcare workers and carers, family members, supporters, they may push people to do more, to change. And when they push on that side of change too much, we get people arguing back against change. We all know that if people tell us to do something, this is how we're more likely to respond. Put your fingers in your ears, because it's difficult to hear somebody telling you what to do. So I just want to talk about how we can approach this differently. So really it's all about a partnership and a partnership working. So we need to show people that we are a good listener. We need to hear what people say to us. We need to ask people rather than tell them. And we need to support people to make their own choices and their own decisions. As I say, it really is a partnership. So here's an example here. Somebody might say, I don't have time to exercise or go to the gym. So for that person that wants to tell you what to do, they might say, well, you know, it's very important to be active. You should be doing at least 150 minutes a week. Or we could have a much more helpful conversation and say lots of people find it difficult to exercise when you're working, you've got kids at school, you're going to lots of transplant appointments. Can I tell you some things which some of my patients have found useful, or some of the other people I've worked with have found useful? Or just it's hard. It's hard to fit in exercise and physical activity. Using questions about change can be really helpful. And this is where using open questions rather than closed questions. And this can, we can do this with ourselves as well as if we're healthcare workers doing this with people that we're working with. So using open questions like, what might be some of the benefits of you or me sticking to the activity plan? What would help you to keep active and motivated to manage your transplant better? I use this one a lot. Imagine you had exercised regularly. How might you feel, or what would be different? I quite often say, imagine that you're coming to see me and you're going to sit in that chair in a month's time. What would you feel would be something that you might have been able to achieve in that time? And how important is it for you to stick to your regime? Or what do you think might happen if you don't do any exercise, if you stay being sedentary and you don't take that first step to becoming a bit more active? That's not to say we can't give advice. We all have to give advice. It's important. It's just how we do it that matters. And I find that asking for permission, so asking somebody whether they actually want to hear that advice, is really helpful, and being curious about what people's response is. So you might give some information and then you want to know what that means to them. How do they feel about that? And then ultimately let them decide. It's that partnership. So this is that ask, share, ask principle. So I might ask, what's your understanding of what the benefits of being more physically active are? And somebody might say, oh, I don't know very much, or I know quite a lot. And then I might say, would you mind if I shared with you some of the tips I have, or some of the evidence that I know that can be of benefit around exercise? If that person says, yes, sure, I might share that information and then ask them, so what do you make of that? What does that mean for you? So hopefully helping people or ourselves make useful choices by having helpful conversations is a way that we can start to take that first step. So now I'm going to just concentrate a bit on what we might be encouraging people to do or to make use of. So first things first, when you're getting ready to start moving, it's really important that you work together with your transplant team. So they know when you are medically stable and when they're happy for you to be doing certain stages. So most people will be got out of bed in hospital, encouraged to start doing some of the things that they've already been doing. In my experience, all centres have different guidelines about when people can step up that activity and progress on. It's really important to do a baseline assessment. And this can be if you're able to see a healthcare worker, so a physio or a healthcare trainer, but also if you're not able to, it's something which you're able to do yourself. There's lots of online resources where you're able to do, say, a sit-stand test or a 6-minute walk test. Why it's really important is from a healthcare worker perspective, it helps us to prescribe an exercise or a physical activity program which is suitable and also which is at an appropriate level. So something which is going to get you more active and give you the benefits that isn't too much, but is also achievable by the patient. From a personal point of view, if you're doing this online or you're doing it for yourselves, if you don't have a physio at work, not at work, sorry, in your transplant centre, then, you know, the important thing about it is that it allows you to see how you can progress, but also it gives you the motivation because everybody needs to know where they start. And then they can see how much better they're getting, how many more steps they're doing, how many more sit-stands they're doing. And that then helps people to stay motivated, to carry on and to want to do more. What's also really important is to do goal setting. And this is from a healthcare worker perspective, but also from our own perspective. And when we're setting goals, we want to make sure that they're smart. So they're specific, they're measurable, they're attainable, they're realistic, and they're timed. So for instance, this could be, if I was to set a goal here, I could say that I want to be able to walk. So that's my specific exercise. I want to be able to walk around the park in the morning, twice a week with my sister, and I am going to do this for the next month. And then when I next see my physio in clinic, I'm going to look at that goal and see where I go from there. So that would be an example of a SMART goal. So what options are there available for transplant recipients? Now you'll have to excuse me because I work mostly with kidney patients, so some of my examples are kidney specific, but they are general, you know, there are lots of different options out there. So as I've mentioned, and as you've heard today, some transplant recipients go out and get active and continue doing the regimes that they've always done. And transplant recipients are not limited by the types of activities that they can do. However, as I mentioned, there are guidelines, and centres have different guidelines. And early on, there are some restrictions around heavy lifting, maybe swimming in communal pools, about returning to contact type sports. So it's really important to, as I say, always work with your transplant centre. But for others, as we mentioned, they need a little bit more support. And so this is where it's really useful to attend an activity programme. We have one which is called Renal Rehab at our hospital in London, where we run specific exercise programmes which are at the right level and can give people the confidence and the motivation to make that first step. One of the good things that did come out of COVID was the rapid evolution of online resources. And this is an example of one. This is a PhD project by Ellen Castle, who works in my centre. And this is an online resource to prevent weight gain for new transplant recipients. 12-week programme with diet, activity and motivation. Other examples are, we have something called Kidney Beam now, which is a physical and emotional wellbeing platform. And this offers live and on-demand classes, and again is something specific to the condition, which means that you feel the confidence of the people that are providing the programme. There are lots of different apps, and there are also lots of different charities who provide advice and exercises which are out there, and as I say, many of which are very organ specific. Not one size fits all. So for some people, they prefer that paper exercise diary, something they can fill in at home, take back in when they next go in, say, to a transplant appointment. Other people find using maps, tracking steps and activity really useful, and having nudges and reminders helpful to maintain motivation. It's just really important that you do a bit of trial and error and find something that really suits you as an individual. So this brings me on to the last bit of my presentation, which is who and how are we going to sustain our motivation to continue on doing our activity. So what we've learned from the research and from clinical applications and from other transplant patients is that at the end of the day, what matters most is the individual. So people in the general population don't all want to exercise at the same time. They don't all want to do the same type of exercise. They don't want to progress in the same way. So why would we expect transplant recipients to do that either? So for each individual, we need to be able to establish what their baseline is, what their goals are, what their needs and experience previously have been, and what support that people need to make that first step and to carry on being motivated with activity. Okay, so how can we maintain that motivation to stay active and to keep physical activity as part of our daily life? So some of the tools which may be useful are having support. So I've already mentioned the transplant centre, so doctors, nurses, if you have access to a physiotherapist or a trainer, but also really importantly, getting family and friends on board or carers involved. Facilities and equipment. So if there is something which is specific to an activity that you enjoy, it might be going to a certain centre, it might be having equipment like a bicycle or something which you purchase, and it helps to keep you motivated to continue on with your activity. I've already mentioned using online resources. What's really important is that whatever you choose, it needs to be enjoyable. Like I said, nobody gets out of bed and wants to exercise, so we have to want to enjoy or be able to enjoy what it is that we're doing to be able to stay doing it. So this is where activity programs like Transplant 2, so cycling with like-minded individuals, or getting involved with the transplant games, or joining a team, those sorts of things can be really helpful for maintaining that motivation And having that, that reminder, if you've not turned up to something, having somebody remind you, ask you where you've been, you know, ask you if you're coming along to the activity. It's also really important that it's regularly organised. Scheduling, planning, arranging with friends keeps you accountable, both to other people and to yourself. Having something in your diary, it's a little bit like when we plan our shopping. If you're going to try and have a healthy week, we plan what it is we're going to eat, we plan what it is that we're going to shop for. If we don't, we know that by the end of the week, we may have made bad choices. If you don't start the week or the month planning when you're going to do your activity, then you probably will get to the end of that week or that month and find that it hasn't happened. So having something regularly planned, you're much more likely to stick with. Nudges are really helpful. So if you've got a diary that sends you a reminder, then you know that maybe an hour before, hey, Charlene, it's time for you to get ready for your exercise program. And then monitoring progress. Like I said, we need to know that we're getting better and that we're able to do more to stay motivated to continue on. So fitness tests, progress charts, regularly reviewing goals, using meaningful outcomes, having a reward. You know, if you stay doing your activity for a month, maybe you have a reward where you go out and meet a friend for a drink. And that's your reward. You know that if you can get all of that done, got something to look forward to at the end. What's also really important is falling off the wagon. So we've all been in a situation where we maybe miss a class or miss a day of walking or miss a week of walking or whatever the activity is. And we go, oh, we've fallen off the wagon. There's no point now. I've stopped doing it. And actually what's really important is to maintain the mindset that it doesn't matter. You restart and you take that next step, or you start again and take that first small step again, but it just doesn't matter if you fall off the wagon, just get back on again. Minimizing the risk of exercise training. So the evidence, as Stefan has told us, we know that exercise is beneficial, but we do need to just make sure that we do it in a safe way, so we minimize injury. So talking, like I say, to your transplant team, starting exercising slowly and progressing gradually, always using a warm-up and a cool-down, and just remembering that not taking part is more of a risk than taking part. So my take-home messages are, it's important for transplant recipients to move more. Exercise, physical activity, any general movement should be individualized to the person. We know that many challenges exist, but we also know that having helpful conversations using behavior change can help us support people to change, help us support ourselves to change. And we know that sustaining motivation requires planning and support, but doing nothing, not doing anything, not taking that first step should never be an option. Thank you very much for listening.
Thank you very much, Charlene. It was a fantastic talk. I think you've kind of highlighted the role of, I suppose, collaboration and empathy, but equally the role of communication and just how important that is, the messaging that, be it medical professionals or patient organizations, put around physical activity, and equally from the patient organizations, what are we saying about it, and how are we helping in that motivation. But I think we shall move into the general Q&A session. So thanks once again, Charlene. Those who are online, you have the chat facility there, you have the Q&A facility there. Fiona, I'm going to hand over to you because you have the privileged position of being able to see all those questions.
Thank you. Yeah, I realise you can't see them. And the other thing to say is we are actually already out of time. So what I'm going to suggest we do is we probably, I think there are three questions there in the chat. So we'll probably, if the speakers could just put themselves back online again. So perhaps we'll just focus in on those three questions, and then Colin, you and I will finish up the session. If everybody's okay, just to stay on for another 4 or 5 minutes maximum. And I hope that's okay with the organisers. I'm sure someone will tell me otherwise, because there's been so much to talk about this afternoon. So some of the questions have been answered already, but so one question here actually is for you probably, Charlene, which is, and I thought of this actually when you said it, because you work at King's, you do a fantastic job there offering rehab to the people that have had transplants, but in many units throughout Europe, that this service is not available, and the sort of advice is, is very mixed. And we know peer support is good, online can be helpful, but there is still that caveat about get advice from your transplant person, care professional before you just jump off and start immediately doing something. So any thoughts about what we can do about the fact that it's variable?
Yeah, I mean, it's a very big problem, I think. I think we are getting there in terms of we've got some really good communities of professionals coming together with different patient-facing charities. So we're doing a lot of work through the Transplant too, in terms of trying to get some consistent messaging out there, some helpful ways to get started. I think what's really important is to make sure that your team, your transplant team, is aware that you are going to be doing some exercise or some physical activity. And as long as you're medically safe to do that, there is quite a lot online, as long as you're using a reputable source for how to get started. And as Stefan said, it's really important just to do something. So if you're worried about going and doing something very active, make that start with doing something like walking, like jogging, and then build up gradually. You'll know if you've done too much, and you'll be able to speak to your transplant team if you have any worries. But the ideal situation, and hopefully in my lifetime, I would like to see every transplant patient have access to a physiotherapist in a unit. But maybe in the meantime, we'll actually be able to make use of online resources more to help deliver those messages.
Grand. Thank you very much, Charlene. And another question, great to mention Transplant too. Again, I should say to everybody, if you hadn't realised, I think it's 1,000 kilometres that people cycled over the last 4 days from that organisation, which is extraordinary. Well, that's what it says online anyway. So that's simply amazing. I couldn't possibly do that, but fantastic job. So a question, I think maybe for Stefan very briefly, which is just about consistency, and maybe Darren or Frank can jump in very briefly, perhaps. So peer support is very important, but we do get different messages from different groups, from different people. So if it's a peer support group that's meeting and giving each other suggestions, that's one thing. But is that safe, or is it just different practices in different places? Where the example here is, sometimes someone might be told that it's okay to swim after 3 months after transplant, but someone else might be advised that it's 12 months. And of course, that is different for the different organs, I suspect, as well. So, Stefan, have you got anything just to mention on that?
So with regards to safety, I think it's very clear that we can say that all kinds of physical activity at light, even moderate intensity, are just safe to do. You will do them anyhow to go to the supermarket or whatever. So those are safe. If you want to engage in quite some physically challenging exercise performances, like climbing a mountain or climbing, then
weightlifting, for example, because some people do that.
Well, for weightlifting, you need to have a good technique, otherwise you may get injured. But that's true for transplant recipients, but that's also true for people who don't have an organ transplant. And I saw the question coming up. Okay, can we do too much? Yeah, of course we can do too much, but also people without an organ transplant can do too much. It will bring you into a state of, which is called overreaching or overtraining in scientific terms, which is due to not respecting the recovery that your body needs after exercise. So that's a logical thing, but your body will tell you you will be sleeping less good, you will be less fun for your environment. Actually, your performance will go down after a while. But so overtraining, you can do too much. With regards to safety, there is one difficult discussion point, that is whether you can go swimming into swimming pools. Are they hygienic enough, or will it increase the risk of infection too much? And the same holds true for open waters where there might be some bacteria. So therefore, I would suggest to refer to the transplant surgeon or the physician. But for the other kinds of physical activity, there are no major issues, although cardiovascular events are more likely to happen after transplantation. So cardiovascular diseases are more likely to happen due to immunosuppression and previous organ disease.
Thank you very much. That's great. I'm just very, very aware of the time and that people are having to leave, probably because they've got activities to go off to. So that's very wise. So take it easy. I think the problem is more likely, rather than overdoing it, it's the underdoing it. To be quite honest with you, but nevertheless, those were the questions we asked. Frank, you had your hand raised. Very briefly, please.
The overdoing is might be more of that people are concerned about their organ. That's what I have heard from many patients, from many transplant patients, that they are worried that their organ isn't safe if they are doing too much.
Okay.
So I do think that was the basis of the question too.
Okay, there is no data showing that too much or too high volumes or too high intensity will harm the organ. Let me be clear about that. So
that's fantastic. So get going, take it easy. Darren, did you want to say anything at all before we close up about the pain or the gain? No.
Well, again, because I'm so enthused by the games and the transplant side of things, they're organized, they're supervised, they're structured, so therefore they're a safe environment to train. You don't have to compete, but they're a fantastic way of meeting other people in a structured, supervised and organized way. Nicely
said. Thank you. And actually, I've only been, we're the Kidney Care UK, we support the British Transplant Games, so I've had the privilege to go there many times, and there's nothing more inspiring than seeing children who are transplanted. I sob every single time, doing their exercise as well, because it's not just for adults, it's for children too, and I think that's a really lovely, important point to make. Okay, then, so I think just as we would like to, so thank you all so much to everybody for taking part this afternoon. We have a couple of small things to do now just before we finish off, and I think the first one is as a short poll, if that's okay. Got my timing right here. Come up on the screen and ask you a question. Maybe. Give that a moment. It's just going to ask you if you have you'll see it for yourself come up as we go, unless I'm going to get a message to say that poll is not coming up.
It's up now for you.
Oh, fabulous. Well, you can see it sooner than me, so great. Okay, we'll just give that a few seconds. And it's just really about confidence. We've just talked quite a lot, haven't we, about safety, about overdoing it, etc. So I wonder if people can see it on the screen there. If people can, this might help us in terms of steering ESOT in the future as well, by hearing from you and things you need to hear about and so forth. So. That's great. I have to keep checking my phone to see if I've been told off for doing anything or not. So that's grand. Is there anyone else who'd like to? Yeah.
It's intriguing watching some of the lines go up and pull back, and like if you had taken snapshots at different times, you would have had a very different view of the story out there. So yeah.
So I can see there the guidance from the physio is one of the most popular things. A program of activities. Yeah, people have talked about that already, haven't they? So, and
I think what it's highlighted is what this whole meeting is about is the need for collaboration between patient organisations who can often facilitate activities, but the medical profession to give guidance and structure. So I think it's actually, in the context of where we're speaking, it's a very positive response that this is what we're moving towards, what we're aiming to achieve.
And I think, yeah, also it's nice to see, because people talked about it as well, that there are online things, the charities, do have resources, so you can look around the patient charities and the Facebook groups and things, and you will see suggestions and support there, which is a place to start. So that's grand. Right, Colin, just I think in terms of closing the meeting, I I think there's a couple of slides that are going to come up as we finish off now on the screen. So thank you for the poll. Right, okay. So I think it's just for me to remind you that there's still those patient centres at the Congress, and if you're interested in joining any of getting involved with ESOT more, you can get in touch as advertised previously. And then Colin, I think the last couple of slides are for you actually.
They are, yeah. Yeah.
You can see them, can't you?
Do you have another coming? Yeah, basically the ESOT EDPO Alliance, it's young, it's growing, and we want you. We want you to engage, because together we can be stronger, and together we can all improve the situation for each other. So check out esot.org, and you can get in contact there to find out more about how you can engage. And if you know of others, be they individuals or organizations who may be interested, the video from today's session will be available through the various social media platforms run by ESOT. So you can look up kind of YouTube, Transplant Live, and if you look up the Congress platform as well. So it will be widely shared, and I can assure you there's plenty of us who will share the sharing and get the message out there far and wide. So we've had a great session, very constructive, and the thing now is we all have to come together and take the next step beyond. We've got as far as Milan, now we have to work towards Athens, and I look forward to collaborating with a lot of people. Thank you very much.
And a huge thank you from me as well, again, to our speakers and all of you who stayed with us to the end. Small steps, important steps. Thanks, everybody, and good night. Thank you all. Bye-bye for now.